and welcome back to our next session, Outreach Efforts to Enroll People in MaineCare Expansion. My name is Becca Bolas, and I'll be moderating today's session. A couple of reminders before I introduce our speakers. The first is that we are offering conference captioning services. Within each session, you'll be automatically provided with captioning, which is underneath the video stream. If you don't need the conference captioning service, you can push the pause stop button and that will stop the stream. The second is to please be sure to complete the session evaluation. It's just 4 short questions and your feedback is very helpful to us and to our speakers, and it is required if you're seeking continuing education credits. So with that, I am now excited to introduce our speakers. We are joined today by Sara Kahn-Troster and Carolyn from University of Southern Maine. And with that, I'll turn it over to you.
Great, thank you, Becca. Hi, my name is Carolyn Gray. I want to welcome you all to today's presentation that's focused on outreach efforts to help enroll people in MaineCare expansion. I'm here with my colleague, Sara Kahn-Troster, which will be sharing with you today what we've learned in the past 2 years about the outreach efforts in Maine. Before we get started, I did want to acknowledge the other team members that we have been involved in this work. Kimberly Fox, Jillian Foley, Martha Elbel-Williamson, Michael Flaherty, Kathy McGuire, Yvonne Junk, just some of the few that have been a part of this work. And also wanted to be sure to thank all of the organizations that we've spoken with over the past 2 years and have worked with. Without their information and feedback, this work would not have been possible. So I just wanted to go over the disclosures and funding for this work. We have nothing to disclose with regard to commercial relationships. And this work was funded through a cooperative agreement between Maine Department of Health and Human Services and the University of Southern Maine, with funding support from the Robert Wood Johnson Foundation and the Maine Health Access Foundation. The views and opinions that we're speaking about here today are the authors and don't represent the collaborating organizations, the University of Southern Maine, or the funders. So today we're going to focus on the outreach efforts to enroll people in MaineCare expansion. We're going to describe the outreach and enrollment assistance efforts, and we're going to also talk about some successful outreach strategies and challenges that were encountered and what opportunities were identified. We're also going to highlight who has applied and enrolled in MaineCare expansion. So to start off, to give you a little background, in 2017, Maine voters approved a ballot initiative for MaineCare expansion. This allows coverage for people who are ages 19 to 64 with incomes below 138% of the federal poverty level. Implementation of expansion was blocked until Governor Mills signed an executive order in early January of 2019 to enact expansion, and this provided retroactive coverage back to July 2nd of 2018. To give you context, Maine is one of 39 states, including DC, that has expanded Medicaid coverage. So grant funding was between 2019 and 2020. The Robert Wood Johnson Foundation, in partnership with Maine Health Access Foundation, provided funding to Maine's DHHS to accelerate MaineCare expansion. And funding of this, the grant funding was used to help support grants to 9 community-based organizations to provide outreach, training, technical assistance, and assistance with enrollment efforts for Marketplace and for MaineCare. We're going to hear more about this in the next couple slides. The department also engaged in several activities to promote MaineCare expansion enrollment, such as a public relations campaign to raise awareness of and promote application for MaineCare and other coverage options such as Marketplace. That's the Cover Me campaign, which we'll again mention a little bit in a few minutes. So to give you an overview of the outreach evaluation, it happened between 2019 and 2021 by the University of Southern Maine's Muskie School of Public Service. We evaluated the outreach and enrollment efforts of the community-based organizations and key stakeholders across the state. And we did this a lot through interviewing with those organizations and stakeholders, as well as receiving data from those organizations we were able to provide, as well as administrative data. And our purposes really were to understand the strategies employed to maximize MaineCare expansion enrollment, identify promising practices, identify what challenges were encountered, where there's some opportunities around outreach and enrollment, and then also to take a look at some trends in MaineCare expansion applications and enrollment over time. So just taking a step back for 1 minute, just to give an overview about what is MaineCare expansion or Medicaid expansion. This is expanding MaineCare coverage for adults ages 19 to 64 with incomes below 138% of the federal poverty level. And MaineCare covers a variety of services, such as doctor visits, prescription medications, and behavioral health services, amongst other things. The department has developed a MaineCare expansion snapshot. You can see the link here, which provides information about the number of people that are enrolled in MaineCare expansion as of certain dates. So this is the latest is August 2nd of 2021. There were 81,954 people enrolled in expansion. And this breaks out into almost 70,000 adults without children and 12,000, just over 12,000 in parents and caretaker relatives. So to give you an overview of outreach and enrollment efforts in Maine between 2019 and 2020, there was the Cover Me campaign that I mentioned. This is the link to the website. This is a statewide media campaign. It included TV spots, radio spots, website. There was also work throughout the state of Maine to provide assistance to help people get enrolled. That was often happening in hospitals, provider offices, amongst other settings. And a lot of this was through certified application counselors and navigators to provide assistance. Certified application counselors are trained through Marketplace and Maine's Department of Health and Human Services, and to help people enroll in coverage. And the navigators are through a grant award from Maine DHHS with year-round funding to provide assistance. There was also, as I mentioned previously, 9 community-based organizations funded to support outreach and enrollment efforts. So as I had said before, it's providing training and technical assistance to other organizations who are also working with people who may be eligible, providing outreach about MaineCare expansion and Marketplace, and assist people with enrollment. To give you a little bit more information about these organizations, a lot were, really the focus was on trying to reach hard to reach populations. And most grantees were working with people who are uninsured or underinsured. So some were working with new Mainers, immigrants, asylum seekers, refugees, working with migrant workers, tribal members, and almost all the grantees provided outreach and or enrollment assistance at some point between this time period. The grantees also do include Maine's Navigator awardee and their partners. And there were some grantees that actually worked with community health workers to provide outreach and enrollment assistance. We're going to hear a little bit more about this, but if you haven't heard of community health workers, they are cultural brokers who are trusted members of the community who can assist people with accessing health and social services. And then finally, as we all know, 2020, the COVID-19 pandemic hit. So there was the public health emergency maintenance of effort. And this really was an effort to provide continuous coverage during the pandemic. So people would not be disenrolled from MaineCare during the maintenance of effort time period. COVID-19 also brought challenges and opportunities, such as moving to virtual platforms. You're going to hear more about that in a few minutes. I'm going to turn this over to my colleague, Sara.
Great. So we conducted 51 interviews with 32 different organizations in the spring and summer of 2020 and the spring of 2021. This included the 9 CBOs that received grant funding from the Robert Wood Johnson Foundation and the Maine Health Access Foundation, and 5 of the Navigator Consortium members. Other interviewees included several hospitals and other healthcare providers, state agencies such as the Office for Family Independence, and organizations that work with populations such as people experiencing homelessness. In the first year of interviews, we specifically targeted organizations in counties that had high or low rates of Medicaid expansion enrollment. And in the second year, the interviews targeted the Navigator Consortium and federally qualified health centers in rural areas. And the interviews were all transcribed and coded for themes, and we used the in vivo analysis software. So what are some examples of, next slide, please, of outreach and enrollment strategies? Outreach was often done at in-person events that focused on MaineCare expansion, marketplace, and coverage more broadly, and that were held in a variety of settings aimed at different audiences, including food markets, community centers, places of worship, hospitals, etc. Obviously, the pandemic caused a shift in many outreach activities. It became more complicated. Most in-person events were canceled. And so there were creative attempts to reach people. Health fairs in a bag was one example, or outreach materials in food bank boxes. But data from the grantees showed that about 84% of outreach done after the pandemic started was virtual. Social media became particularly important. Facebook, Instagram, Twitter, and also WhatsApp. WhatsApp is a no-cost texting application that's popular around the world, and especially with new Mainers here. And it was used to disseminate information about workshops or public service announcements. Organizations obviously relied on word of mouth, including people walking in off the street and hanging out in community organizations or talking to community health workers, or referrals from existing clients. Brochures and mailings and articles and community newsletters were done, including e-newsletters. Print materials are still a very important way to reach people who don't have regular internet access, especially if you place the materials in community settings. Enrollment assistance, this could be anything from answering questions about eligibility or concerns, or actually helping people fill out the online or paper applications. The sisters are usually available to help with both MaineCare and Marketplace. Once the pandemic started, there was a shift to virtual enrollment assistance, primarily via Zoom, but also over the phone. Hospitals and other healthcare providers work with new and existing patients to do in-reach. They used a variety of strategies to identify patients who might be eligible for MaineCare or for Marketplace subsidies, including flagging self-pay and uninsured patients for calls from enrollment counselors, collaborating with their billing departments to identify patients who were struggling to pay medical expenses, and screening all in-person patients for eligibility for multiple benefit programs. Some practices educate providers and other staff to discuss coverage options and refer patients to patient assistance. And they also place signs and flyers discussing MaineCare in exam and waiting rooms. This kind of outreach continued during the pandemic, including especially proactive outreach to eligible patients. Next slide, please. So what were some of the common strengths and successes of outreach enrollment discussed in interviews? Many organizations felt that virtual enrollment assistance was a huge strength. They removed barriers around transportation to an office or clinic. Some interview participants thought it was beneficial to assist clients who were in their own homes, where they had all of their documentation and information on hand. But whereas in the past, it was common for someone to come into an appointment and have to leave and come back because they forgot a particular document at home. Working virtually allowed some organizations to expand their geographic reach and assist people statewide, particularly with MaineCare enrollment. And one organization highlighted the fact that now they could share staff between their facility locations to meet demand, since they did not have to actually be on site. Organizations that use community health workers really found this to be an essential outreach approach for working with their target populations. A community health worker can explain complicated issues from a culturally responsive, nuanced perspective in their community's native language. CHWs were able to overcome barriers with their communities, such as a lack of understanding of the US healthcare and health insurance systems, fear or mistrust of public systems in general, and educating clients to overcome myths about MaineCare. There was some discussion in interviews about how community health workers could even be used to reach other populations that have enrollment challenges, such as rural Mainers or people experiencing homelessness. As I mentioned, many healthcare organizations developed successful in-reach strategies for existing patients. And some of the interviewees mentioned examples of support and collaboration with their peer networks, which really helped them with problem solving and resource sharing. A particular example was the Assister listserv, which is for navigators, certified application counselors, and other sisters from MaineCare in the Marketplace. It can be used to help get information on issues related to enrollment, such as eligibility, household size, estate recovery. People can email the list and get pretty quick feedback, and they can use it for sharing of resources and materials in real time. Next slide, please. A few more successful outreach strategies that we wanted to highlight. Creating engaging social media content, like using pictures of pets to catch attention and get people to look at MaineCare expansion related content. As I mentioned, social media became particularly important once the pandemic shut down in-person outreach events. Sending out regular emails and newsletters to clients and constituent groups. Some organizations also were able to add coverage-related content to a partner organization's newsletters, and including the Department of Labor's newsletter to people who are unemployed. People developed multilingual materials responding for a real need for materials about MaineCare in other languages. MaineCare fact sheets were cited as an example, and one grantee created videos about MaineCare enrollment in 6 languages and posted them publicly on their website. And those are a real how to apply for MaineCare basic informational resource. As I've discussed, providers did a lot of direct outreach to eligible patients, particularly during the pandemic, to discuss MaineCare and the marketplace. And CHWs were utilized by organizations serving new Mainers, migrant agricultural workers, and other people with cultural and language barriers to help clients understand what benefits were available to them and also to help them enroll. Next slide, please. Great. So unsurprisingly, COVID-19 created real challenges throughout, and it was a major theme throughout the interviews, particularly the second round of interviews in 2021. In particular, the lack of in-person outreach events reduced the ability to reach an audience for some organizations who had to move all of their outreach activities online. And with offices closed, community-based organizations also couldn't reach people who previously would have just walked into their office to hang out or to access services. There were internet and technology access challenges. People didn't know how to use Zoom or have devices that could access Zoom. Clients didn't have privacy in their own homes. Many of us work from quiet offices. Many people do not have that. Access to technology and reliable internet connections was especially challenging for people experiencing homelessness, rural communities, and older Mainers. I should add that while some interviewees felt that virtual enrollment was a success, others found that meeting virtually for enrollment was less efficient and that they had a hard time engaging clients. One of the biggest challenges to virtual enrollment assistance was the fact that the paper applications had to be mailed to patients to collect signatures, which made the process slower, and many applications were not necessarily returned. Also, some interviewees were limited by organizational policies that prohibited them from printing and mailing applications from home where they were working, or from utilizing online application forms due to HIPAA concerns. People also discussed slow processing times for MaineCare applications, as well as long wait times on the phone with the OFI call center, although I should note that that was also a concern before the pandemic hit. Beyond COVID-related issues, there was a lot of discussion about the general lack of awareness and understanding about MaineCare expansion specifically, and the marketplace, as well as low health literacy and confusion over terminology among the general public. People don't necessarily know that expansion happened, or if they do, they don't know what it means for them. Interviewees found that people largely do not understand their health coverage options or how to navigate the health insurance system. Younger Mainers who had not previously accessed services and people who had previously been denied MaineCare coverage were cited as 2 populations where there seems to be a low level of awareness and a high level of confusion. There were also barriers mentioned to reaching specific populations, as well as cultural and language barriers, which we'll look at in a second. And many participants discussed having to work with clients to overcome a sense of stigma, fear, and mistrust in public systems, including cultural challenges around asking for help, clients who had previously had bad experiences with DHHS or other public systems, and clients who had previously applied for MaineCare before the expansion and were denied, or who they believed were not eligible. Some interview participants commonly cited challenges reading 3 particular populations: rural and island communities, immigrant populations and asylum seekers, and people experiencing homelessness. Rural Maine communities were noted by interviewees as a population that continues to present a challenge for MaineCare enrollment due to a lack of community connections, cultural barriers around asking for help, mistrust of public systems, including the healthcare system, and access to transportation, both in general, but also in terms of accessing organizations that assist with enrollment. Piscataquis and Washington counties were explicitly mentioned as being hard to reach, and organizations that work in those counties have a sense that they are under-enrolled for MaineCare, including MaineCare expansion. A few participants also noted that island or small coastal communities were similarly a challenge. They may have many seasonal workers who often have issues with eligibility because of their variable incomes, such as people in the fishing industry who may have high incomes for one season, but no income the rest of the year, which may leave them ineligible for MaineCare or even for marketplace subsidies, but they're still in need of support. Among the organizations that work with new Mainers and asylum-seeking populations, commonly discussed challenges include eligibility issues, document requirements, and language and cultural barriers to understanding the healthcare system, including MaineCare and how to enroll. A particular concern prior to the change in the presidential administration was overcoming the fear of the public charge rule, which was expanded to include Medicaid as one of the benefit programs that could potentially count towards determining if someone was a public charge when they were applying for a visa or green card. This rule was repealed by the Biden administration, but many people were not aware that it was repealed and were still afraid that applying for MaineCare might affect their visa status. Finally, several participants mentioned that people experiencing homelessness are particularly challenging to reach because of lack of access to technology, such as phones, internet, or email, not having a permanent mailing address, or not having needed documentation. Often the only chance to help them is when they are visiting a hospital or other provider, as once they leave, they usually lose contact. I'll turn it back over to Carolyn.
Great, thank you. We're just going to give us a quick overview about MaineCare expansion enrollment in terms of people who have enrolled in expansion since July of 2018. You can see here that there were 110,364 newly eligible Maine residents enrolled in expansion between July of 2018 through April of 2021. And this is really summarizing up anybody that has been enrolled, ever been enrolled in expansion. If you look to the two maps here, in terms of numbers, that's the first map. You can see where people live who enrolled in expansion in total. And then the map on the right shows this information relative to county population estimates. And this is using MaineCare enrollment data and American Community Survey data from 2019 5-year estimates. You can see in terms of the numbers of in that first map, Cumberland, Penobscot, and York are also the most populous counties and the counties in the census that had the most numbers of potentially eligible and led the state in total expansion enrollment numbers. However, if you look at the map on the right, a larger percentage of the total populations in Washington, Aroostook, and Somerset enrolled in expansion than other more urban counties. So this is just looking at expansion enrollment over time and by county. And you can see new enrollment was highest in 2019 and declined by about 25% in 2020. This is pretty similar to what we were seeing even in MaineCare applications overall as well. And enrollment at the county level by year follows a similar pattern. 2019 and 2020 enrollment declines were sharpest in Washington, Aroostook, and Piscataquis counties. In terms of demographics of those who are enrolled, in terms of race and ethnicity, of members with recorded race and ethnicity data, 4% are non-Hispanic Black, 2% are Hispanic, 90% are non-Hispanic White, and 4% are another race. 11% of those that are enrolled, the race and ethnicity is unknown. And expansion enrollees appear to be more diverse than the overall Maine population, which is 93% non-Hispanic White. In terms of language, roughly 4% of expansion members speak a primary language other than English. And in terms of age, the majority of expansion enrollees are younger than 40 years of age, 7% are over age 60. So this just provides a little bit more information about the language and the counties and how it's broken out. Expansion members speak 57 different languages, 4% speak a primary language other than English. And Cumberland and Androscoggin counties have the largest number of expansion members whose primary language is not English. Somali, French, and Arabic are the top languages spoken by those whose primary language is not English. And you can see on the pie chart here to the right, a breakout of the top languages among enrollees whose primary language is not English. So in terms of outreach opportunities, there's three that we wanted to highlight. The first is continuing a hybrid approach and enrollment assistance post-pandemic to meet clients where they're at. So this is like continuing to offer virtual assistance, would help organizations reach the widest audience and best respond to clients' needs. It also helps address transportation barriers and expand geographical reach, and also helps with flexible staffing. The second opportunity is dedicating resources to support community-based organizations and expand the community health worker model to reach more diverse, under-enrolled populations. CHWs have been most successful in reaching diverse populations because of their cultural competency and connections to the local community. And this model is really key to building trust and reaching immigrant populations and asylum seekers, but it could also be expanded to other local connections and other hard to reach populations as well, such as rural communities, people's experiencing homelessness is just some examples. And providing support to local organizations to serve strategic populations is also really key to reaching more people and building local connections. So connecting with like food pantries and shelters and so forth would be some opportunities. And having long-term sustainable support for these efforts is also an opportunity and needed. Finally, expanding outreach using a coordinated statewide multi-channel general education campaign with targeted local and culturally responsive strategies is definitely an opportunity. This needs to be focused on building a broad awareness and knowledge about Medicaid expansion and using multiple channels like TV, radio, social media, print in order to reach all audiences. Using multiple platforms is also to reach a wider, more diverse audience. As Sara mentioned about Facebook, Instagram, there's TikTok, there's WhatsApp. But also having print materials as well to be able to reach with smaller communities and populations that may have limited internet access is also important. Having all materials be available in many languages, we just saw some prior slides about multiple languages spoken. So available in many languages, and also to be adaptable materials so they can account for culturally specific needs and nuances and eligibility and options. And having the messaging also be used to address common myths, fears, and questions is also advised. So I'm going to end with that, and thank you for being part of this presentation. Sara and I have our contact information. If you would like to contact us, feel free to after if there's additional questions beyond this presentation.
That's great. Thank you both so much. I do have a few questions that have come in, and I'll just ask folks that are in today's session, if you have any others, to just put them in the Q&A feature, and I'll be happy to relay them. So one question is about whether you saw any differences in enrollment based on gender and household size. Do you know if there was any variation between, the example is, were there fewer single men than single women, for example, that were interested in enrollment? Did you see any variation along those lines?
I don't believe that there was. We have to go back and double check, but I don't believe that we saw anything of that nature in terms of gender. In terms of household size, I'd also have to look at that as well, but I don't believe that there was anything striking on those two factors.
Sure, thank you. And this question is acknowledging that this was mostly a qualitative analysis, but they're wondering if you have the data to explore which types of outreach and enrollment strategies worked best for different populations. And I know you touched on rurality and immigration and homelessness, but are you able to kind of parse down even further to look at which types of outreach and enrollment strategies worked best?
I think a lot of this is, as you mentioned, it was qualitative as being the primary source. It is challenging to be able to fully dig down and to be able to report on all the different outreach efforts. We actually were trying to do that as well. And But it's hard to get a full picture of the entire state of all the different, ways that were provided to drill down on that. It's challenging to collect that information. And that's also been consistent with other outreach evaluations as well.
Yeah, I remember when we were enrolling people, when I worked at Tufts, we were enrolling new immigrants to Massachusetts into a study, and trying to figure out which types of outreach and recruitment strategies worked best for the different populations was really difficult. It's not an easy activity, so I completely understand what you're saying. Just one more question, because I know we're at time. I do think it's a good question. So have you, or are you going to share your results back with your interviewees? Just curious about their reactions and how these findings can inform their work going forward.
Yes, and we actually already shared our interim results from the first year of the work back with those that we had spoken with to help inform, obviously, their work, because they're working on this every day. So yes.
Good. That's great. good evaluation practice. So thank you so much to Carolyn and to Sara for being here. And thank you to everyone who joined us in this session. There was a lot of really informative information, somewhat redundant, but a lot of good information that was presented. So thank you for that, for your work and for being here. Before folks leave, a couple of quick things. First is, please don't forget to complete the session evaluation, just four questions. And just a reminder, I don't think we've pinged you enough. We want to remind you again to please join us in 10 minutes for our poster session. To join the poster presentations, you'll just have to click on the poster reception, which is in the agenda, and then enter that session and then enter the Zoom room. We're doing those via Zoom because we have different breakout sessions. And just as a reminder and a little incentive to join us, everyone who attends will be entered to win one of 10 organic t-shirts that were generously donated by the Natural Resources Council of Maine. And for those of you who are participating in our challenge, there will be a poster session exclusive trivia question, so help kind of keep you bumped up in the leaderboard. So with that, I just want to thank you all again for joining us in this session. And again, thanks to Sara and Carolyn for being here. And we hope to see you in 10 minutes at the poster session.